I'm Galindo from UMKC. I'll be doing a head-to-toe assessment today. I'm going to wash my hands and I shut the door for privacy. Alright. Can you tell me your name and your date of birth?
Caitlin Paragoy, 04/03/1996.
Alright, and can you tell me who the president is?
Obama.
Can you tell me where you're at right now?
UMKC.
Alright, and then can you tell me today's date?
It's the 15th of November.
Alright, okay, so she's alert and oriented, ×3, everything's good. Alright, now I'm just going to go ahead and start it with those skin assessments. I'm going to check her temperature of her body, make sure everything's nice and warm and bilaterally even. Okay, no edema, and everything looks good. Even the feet, everything feels warm. Now I'm just going to go ahead and check her nails. She does have nail polish on, but there's a few things. So far from the nails I can see the cap refill is less than 2. Nails are nice and clean. She definitely takes care of herself, good hygiene. And then also before I go any further, do you have any allergies?
No.
Okay, so no allergies are noted. Everything's good with that. Alright, so then I'm going to go ahead and check for her hair. So I'm just going to look through her scalp and feel, make sure there's nothing abnormal there. And this doesn't hurt or it's not tender, is it?
No.
And anytime you feel anything tender or hurt throughout the point of this head-to-toe session, just let me know. Okay? Looks normal cephalic. Hair is pretty thick, good, evenly distributed, nice and even. Okay, perfect. Alright, now I'm just going to go ahead and check your face. You can lift your eyebrows up for me, smile, frown, and you can puff your cheeks. Can you do it one more time? Puff your cheeks up. Okay, good. Well, you're supposed to let it out. You can let it out. Do it again. Don't let it out. Just let it go. Okay, perfect. Good, even throughout. Okay, so that was checking cranial nerve 7, so that's good. Now I'm going to check cranial nerve 5. You can open your jaw and then close it. Okay, does that hurt or is it tender at all? Alright, and if you can clench your jaw, I'm going to try to pull it down, don't let me. Okay, then I'm going to examine the inside of your mouth. Okay, nice teeth are white, straight, pearly, beautiful. Gums are pink, there's no lesions, anything going on. You can open your mouth, we'll test cranial nerve 12, and lift out your tongue and then move it from side to side. Okay, tongue is nice and pink and even, no lesions, no abnormalities noted, so that's fine. Alright, and then we're going to move on to cranial nerve 9 and 10, and we'll check your, we will check your uvula and your tonsils, so you can open your mouth. I need a pen light. Right, you can open your mouth. Okay, tonsils are present, so about 1+. Uvula is nice and even. You can say ah for me. Okay, the palate constricts, there's mobile right there. Okay, perfect. Alright, so everything's intact. And then if I can check your temporal arteries one at a time. Okay, perfect. Alright. So your temporal arteries are a 2+ and even on both sides. Alright, and now if I can just check your eyes for you. Alright, so I'm just going to go ahead and inspect them first, make sure everything's okay. And then I'm going to just kind of examine them with the light. Alright, perfect. Okay, then I'm going to look at your conjunctiva, nice and pink. The sclera is white. Cornea, there's no cloudiness. It's pretty clear when I looked on the side and everywhere else. The irises are nice, round, and flat, so everything's good there. And then now we can do a few tests. So I'll have you follow my hand. We'll test cranial nerves 3, 4, and 6. Okay, and as I'm doing this, I don't see any nystagmus present, so everything's good so far. Right now we'll test for accommodation. So if you can look at that red fire thing for me, and if you can look at my finger. Okay, and the converge and the pupils constrict, so everything's good with that. And then also if I can have you just look at that light up there. Okay, the light from the ceiling is in the same spot in both eyes, so everything is good. And then now I'm just going to go ahead and test for, so that was Perla. So we completed Perla now, and then what else I need to do? I guess I can move on to your ears now, or your lips. Everything was good with your lips. Fine. Face is good, nice and even. Nose is midline. It's intact. There's no lesions on it either. If you can just occlude one nostril and breathe in really hard, and then do the same for the other side. Okay, it's pretty painful, a little sniffling, not too much. Then we can move on to the ears. Okay, so I'm just going to check the auditory meatus, make sure there's no lesions, make sure it's nice and pink, the same as all the rest of the skin. Everything's intact. I'm going to pull on the pinna and the auricle to make sure it's not tender or sore, is it?
Mm-hmm.
Okay, go to the other side, check for the meatus as well, make sure everything's good. Okay, perfect. And look at the auditory meatus. Okay, everything's fine. Okay, good. Alright, and now I'm going to examine the inside of the ear with an otoscope, make sure everything's good. Turn on the light. And then I'm going to position it this way, hold our head this way, and then look in. Just slight suburban noted, but it's yellow, not obstructing the ear. The cone of light is at 5 o'clock because we're in the right ear. And I'll move over to the other side and we'll do the same thing. Okay. Ear, pull the pin up and back for adults, down for kids. Okay, same for this side. There is slight suburban noted, but it's not obstructing anything in the ear. Since we're on the left side, the cone of light is at the 7 o'clock position, so everything's perfect with that. Okay, and now check if your nose is patent, so I already did that. Now I guess I can move down to your neck and we can do the lymph nodes. Okay, so you have your preauricular right here, your postauricular here, jugular digastric, your submandibular, your submental. There's a deep cervical team right here, your superficial cervical, supramental, good, supraclavicular, I think, yeah, yeah, supraclavicular, and then also we have the occipital ones back here, and then the posterior cervical ones over here. Okay, so there was no swelling, or did it feel tender? Did it hurt at all?
Mm-hmm.
No, it was fine. Okay, now we're gonna test cranial nerve 11, I guess, and we're gonna do your shoulders. Maybe lift up, and I'll try to push down. Let me, and then do the same. Do the shoulders, and then try to lift up. Okay, good, even strength on both sides. All right, now if you could move your head down, touch your chin, and then back, and then ear to shoulder, ear to shoulder. Perfect, so that's good. All right, now if you could, we're gonna look at your nasal mucosa. Okay. What's that one? There we go. All right. Might take a little bit. Okay, everything's nice and pink and red this side. And then we'll do the same for this side. Okay, moist, nice red and pink. So everything's good with that. And then also we're going to do your thyroid. So if I have you look up. Okay. I'm just going to feel for it. It's not really palpable. If you could look to the left though. And then if you look to the left. And if you go, if you're keeping your head up. And then look to the right. Okay, so the trachea is midline, no deviation. There's no goiters. I don't really feel, there's no inflammation of the thyroid. Yeah, so that part is fine. And then next we can move on to, I guess we'll go to the lungs. We'll just examine it, make sure the thorax is a nice 1-to-2 ratio. If it was 1-to-1, it'd be a barrel chest, but it's not. She has a nice good 1-to-2 ratio. So we're good with that. And then we're also just going to now auscultate for her lung sounds, which I'll do with the diaphragm. And also just maybe you turn that way and we'll do the symmetrical expansion first before I do this. So I'm not going to pinch her, I'm just going to put a little bit of skin right there and have her take a deep breath. And sorry, my hands are probably cold. Okay, and they evenly expand and contract, so that's good. Everything's perfect with that. And that was at the T9, the T10 area. And then now we're going to auscultate for lung sounds. So we're going to do the bronchiovesicular back here, and then, there we go. And then the vesicular all the way around the lungs, which is on the peripheries, with the diaphragm, of course. Okay? You're just going to be breathing and out. Okay, now the vesicular ones. Oh, from side to side comparison. Alright, and tell me if you feel dizzy at any time. Okay, good. So, no adventitious sounds in the posterior part for the lungs. Now we're going to do the front part. And we're also going to do the same thing we did with the back and examine the symmetry. Sorry, my hands are cold probably. Okay. Okay, good. Even expansion. The thorax is pretty symmetrical, downward sloping ribs, so everything's good with that. And then we'll go ahead and start with the bronchial sounds, which are high-pitched sounds, which are going to be right here in the neck. Bronchiovesicular will be down the chest right here, and vesicular will be on the outside. This right here, the low-pitched, mid-pitched, and then high-pitched sounds. Okay, listen with the diaphragm at the angle of the jaw. You can breathe in. Okay. Mid-cervical. Right then at the base of the neck as well. Okay, those are good higher pitch sounds, and then we're going to do the bronchiovesicular. Okay. Alright, and then now the vesicular sound is on the outside. Okay. Yeah, we'll just make it work. Okay. Okay, so the same as with the posterior, there's no adventitious sounds, everything was fine. Now I guess we can move on to the heart and the carotid arteries, I guess. So first, I will just listen to your or feel your carotid arteries one at a time because you don't want to occlude any blood flow to the brain. That's a good thing. Okay. Okay, so 2+ bilaterally, everything's fine. The carotid arteries. Now we're going to check for the jugular vein distension, which would indicate heart failure if you did have it. So I'm going to need my light. Okay, so I'm going to have you raise this up to about 30, 45 degrees. That's about, that'll work. Okay, now have you turn your head. Okay, and I'm going to use the light to see if I can see. Yep, and I can see the pulsations from the jugular vein, but it's not distended, so everything's fine, no heart failure. No jugular vein distension, but like as I'm going to lift you up though, as I lift you up, it should disappear. Perfect. Okay, so it's not present anymore, so everything's fine. And then now we're going to listen to the carotid artery sounds right here. And we're gonna listen for any bruise or anything, so we're gonna listen with our bell, so you make sure that is in place. And if you can exhale whenever I look at it. All right, the other side. Alright, and there was no swishing or turbulent flow, so that means she has no bruise. And now we're just going to get a feel for the heart, so we're going to use the diaphragm and just listen to the apex and the base of the heart. And at the apex, the S2 is loudest, and at the base, the S1 is loudest. So we're just going to do that first with the diaphragm. Okay, now we're going to go to the apex of the heart. Okay, everything sounds fine with that. And now we're going to do the abdomen as well. So we're going to start with the aortic, which is right here on the right side of the sternum, the pulmonic, which is on the left side of the sternum. And then we'll do Erb's point, which is a few intercostal spaces down. And then we'll do the tricuspid and the bicuspid, which is right here. And apex. So the apex of the heart is up here. No, apex is down here, and that's where S1 is loudest. So apex is where S1 is loudest. Okay, and the S2 is at the base. That's where S1 is loudest. Okay, and I'll listen to the diaphragm first, and then I'll go through all the points with the bell. Okay. Excuse me.
It's okay.
Okay, and the tricuspid. And the mitral right here. And then now I'm just going to do that again with the bell like I previously specified. Okay. Okay, so no murmurs, no bruise, no swishing sounds. And then now we're going to have you lean forward kind of, and then we're going to listen to your pulmonic and aortic sounds. Okay. Okay, now everything sounds fine. All right, now we're going to have you, we're going to feel for your apical pulse and check for any S3 or S4. Yeah. All right, so I'll listen, if you can turn to your left, I'll listen with the bell side for any bruise with the S3 or S4. It's really loud right here.
Yes.
It's a good one. Then S4.
I can feel it through my bra.
Hmm?
I can feel it through my bra.
Really? It's like boom, 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 boom. Okay, so everything sounds fine. Now we're going to do your apical pulse for the test. See if it's okay. All right, I'll look at the clock over there. So you can lean to your left. Keep leaning. Okay, my hands are a little cold, just so you know. Oh no, Oscar will take this as well for the apical pulse. Okay, so the rate was about 76, which is within normal range. The rhythm was fine and regular. Fine and regular, so everything's good with that. Okay, and then now we can move on to our abdomen part of this section. So first I'm just going to inspect it, look at the contour, it's evenly flat, umbilicus is midline and inverted as well. Everything looks intact, there's no lesions, no moles, skin is nice and warm on each side. Now we can inspect it, so now we can auscultate for bowel sounds. We can auscultate for bowel sounds now. Yeah. Okay, and we'll just do that in each 4 quadrants, and then if we don't hear it in any of the 4 quadrants, we have to do it for a full 5 minutes to explicitly say, to explicitly say if there's no bowel movements going on. So I'm just going to take a listen. Oh, is that cold?
Just take a
Sorry, here. I'll do it slowly, kind of. Alright, it does sound a little hyperactive, so she might be a little hungry. I don't know.
I just ate a granola bar.
Yeah, and then we're going to check for breweries, renal breweries and aortic breweries in the abdomen as well, so we'll do that with the bell. Okay, so no renal or aortic breweries, so everything brewery, so that's good. Alright, now we can go ahead and percuss, and then whenever I hear timpani, it just means it's over open space. Whenever I percuss and I'll hear a dull sound like over the liver, it'll be pretty dull. My hands are probably cold, I'm sorry.
Just don't mind
Okay.
me.
Okay, so it's starting to get dull over here on the right hand side where the liver's at. And the same with the spleen as well. Okay, and now I'm going to palpate the abdomen. First, we're going to use light palpations, which is just with one hand. Sorry, it's gonna be cold. It's gonna be a little cold. Is that cold? I'm sorry.
Oh, it's so cold.
Flexing, I can feel it. Alright, then we're gonna do deep palpations with 2 hands. I'll do it with the warm hand, or try anyway. Sorry, I'm so sorry. Okay, and there was no tenderness or wasn't swollen, doesn't feels alright, didn't hurt or anything. Okay, now we're gonna palpate for your kidneys and your spleen. I know my hand's gonna be cold again. So, okay, get ready here. Okay. Okay, breathe out. Okay, I don't really feel anything, so it's fine for that side, which is normal for kidney finding. And now I'm gonna have you breathe in and hold it, and I'm gonna stick my hands underneath your rib cage. And then breathe out. Okay, and I can feel the pressure from the liver, and then I'm gonna move to this side, and we're gonna do the spleen and the other kidney. Okay, we'll do the kidney first, that's 2 hands. Okay, nothing noted there. And then we'll also do the spleen for this side, so we have you breathe in again. And breathe out. Okay, and that didn't hurt, it wasn't tender or anything.
Nope.
And then I could feel the presence of the spleen there, which was fine, everything was good. And then now we're gonna do, if you can probably prop this back up. Okay, perfect. I'll put the pillow there for you. Great, now we're just gonna check your lower extremities and check your pedal, dorsalis pedis pulse and your posterior tibial pulse. And we're just also going to check for edema or anything while we're down here as well. Sorry, my hands are cold again, I know. Everything looks fine. Alright, can you flex your toe up for a second? Okay, then you can put down. Okay. And this toe as well, just flex up a bit. Pretty good pulses in the feet. Great sign. Okay, now the posterior tibius or tibialis or whatever it's called. Okay. I guess I can take the cap refill of the toes while we're down here as well, just to make sure everything's good and golden. So, pulses are pretty good, probably a 2+ bilaterally. Everything's checked out okay. No edema, no swelling. Nice and warm. Bilateral as well. Skin color, nice and slightly tan. Perfect. Now we can do the musculoskeletal system. Okay, we'll just start with the feet though first and your hips. Okay? So I'm gonna cover you just a bit. Alright, if you could pull this out, yeah. Better? Okay. So now if I can have you just raise your whole leg up, okay, perfect, and back down, and then do it with opposing force, perfect, same side for this one, okay, and the other side, up and down, perfect, and then force, and then I want to have you rotate your hip or your leg inward and outward then, okay, and then with force, okay, good, and the same for the other leg, out, in, and then with force, out, and in. Okay, everything's good with that. And then have you lay your legs out flat. Actually, do your knees. If you could just like that, okay? Keep doing that one more time. And then with force, perfect. And the other side, perfect. And then if I could have you move your just legs out, abduct and induct, sorry. So, no, lay them flat. And then abduct, okay, then with force. Okay, abduct, and then try abducting, and then abduct, and then abducting. Okay, everything's good. And then if you could roll your ankles, make sure everything's good, and then flex them, and then extend them. Okay, and then we do opposing forces. So there you go. Okay, perfect. And then if you could invert them and then evert them, then we're gonna do that with a little bit of force. Invert, then evert. Perfect. Invert, evert. Okay, perfect. So everything's good with that. And then we'll check her leg part at the end. So we're doing that with her spine. And then we'll go ahead and just do the shoulders, I guess. Perfect. See how much time I have left. Okay, I'm doing fine. Okay. Now roll your shoulders forward. And then roll them backwards. Okay, test it, and then you can put your arms out and in. Flex them and extend your elbows, okay? With force. Okay, good so far. Good force. Okay, and then you can have you just turn your neck this way, back, this way. Also, if you can put your hands this way, and then back down. Okay, everything's good with that. And now I guess we can do hands. So you can out, in, clench them, squeeze my fingers. Okay, good even squeezes with both sides, so that's good. If you can just touch your hands back and forth. Okay, and then if you could also, so you're gonna put your hand on your nose and you're just gonna touch my finger. Okay. Perfect, good. Okay, and then we can do, I guess while we're just doing cerebellum, we can just do the romber. Oh, and actually if you could roll your wrists as well, and then up and down, and then I'll do opposing forces. Okay, push down. Okay, perfect. And now we can do the romber test. So, will you stand up, please? And then I'm gonna have you turn this way, and then I'll put my hands right here, and then for like a minute, 20 seconds. I can't remember. But there shouldn't be any signs of her wobbling or moving to make sure she has good cellular function. Okay, we'll do this for 20 seconds and just have her eyes closed. Okay, perfect. So there was no like some wobbling or moving. And now if we could also just have you sit back down, please. And then if you could do fast moves on your legs like this, back and forth, back and forth, back and forth, back and forth. Okay, perfect. And then we can also do the sharp and the dull test. So I will have you, close your eyes and just tell me where it's at and if it's sharp or if it's dull. Close your eyes.
Dull.
Okay.
Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Dull.
Okay, so everything's fine. Okay, and then if I could also have you move the back of your heel and move it down your shin for both feet. Okay, perfect. Now we're done with that, and now we can test some good cerebral function. And we can do reflexes with my reflex 10 or whatever. So I'll do the bicep. Might have to reinforce it to get it to go. Okay, just relax it. Okay, and then we're gonna do the tricep. Just relax your arm. Okay, we'll test it on both sides. Okay, and then just relax your arm. Okay, perfect. Now we can go to the radial. Give me 1 second. The brachioradialis. And we'll just test that one. Just relax. Okay, perfect. Okay, and now we'll check our knee reflexes. Okay, perfect. Okay, then we'll do her Achilles reflex, and it should plantar flex. So I'm just gonna load it up a bit, move it up and down, and I'm gonna strike the back of her heel, where her Achilles is at, and it should feel, oh, perfect, the downward pulsation reflex. Perfect, okay. And then we can also go ahead and check your spine and your back as well. So now you stand up. And if you could also move your legs back just so we can make sure, just like this, since we didn't get to do this when you were laying down. Okay, perfect. And if I have you touch your toes and I'll examine your spine. Okay, perfect. Everything's nice, intact, even, no scoliosis. It's nice, aligned, and straight. And then, okay, and also, so if you can twist back and forth, and then go side to side like this, and then back, and you already did forward, so we're good with that. Okay, and then what else do we need to do? I have you sit down again. Oh yeah. Let me see. Okay, so we'll have you do the eye test now. So I can have you hold this 14 inches from your face. Okay, and then if I have you read the lowest line for me.
428,739.
Okay, if you can include one eye.
428,739.
And include the other eye.
428,739.
Okay, so perfect. She has good 20/20 vision in both of her eyes. Nice and even, nothing wrong. Okay, and I think that concludes our head to toe assessment. So thank you, Caitlin, so much.
All right.